Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, today what I want to talk about is purpose. Purpose is probably one of the most important things in a personal injury practice if you're going to grow a practice. In my experience, you got to have purpose behind it. And purpose is the reason why you do something in the first place. And that reason is sort of your gauge, it's your North Pole, it tells you where north is, it tells you when you're off track, when you're on track. It's the thing that helps you to know if you're improving or not. And so purpose in my experience in a personal injury practice for long-term ability to grow and long-term ability to maintain and manage great staff and to have a super, super great clinic has got to really amount to one thing. It's got to have the reason that you want to have an injury practice in the first place should be excellent clinical results with patients, excellent treatment results, patients that come off your treatment line, out of your treatment programs, that are as close to possible 100% made whole. Yes, they may still have physical derangements that cause impairments, but those impairments are not causing any problems. There's no duties under duress. There's no loss of enjoyment of life factors. There's no activities of daily living that are negatively influenced currently by the patient. That is the ultimate of what you want to create. You want to create that as quickly, as efficiently, and as cost effectively as possible, because then you have something really to market. You really do. I don't care if you want to market to attorneys, you want to market to medical doctors, you want to market to companies, you want to market to the patients direct. If you can do that, then you are what everyone in the market needs. And neck and back injuries are the most problematic injuries in the market today. No questions asked. I mean, I've talked about it in other podcasts. The biggest problem is diagnosis. Ligament injury diagnosis is the number one problem. Most doctors don't know how to diagnose those things. So when you have the purpose of basically getting great patient results, of course diagnosis is going to be prominent, because you have to know where the injuries are. You have to know how bad these injuries are. And you have to know what you're doing with the injuries in order to get great results. And quite frankly, anyone listening to this, whether you're a doctor, you're an attorney, you're a lawyer, you're an insurance carrier, you're a patient just listening to this podcast, what is required for the professional that you want to deal with as your doctor is continued education. Your doctor has to continually educate himself on the condition that he's treating, how to better diagnose it, how to better treat it, how different modalities help it. And you have to, as a doctor, you have to stay on the cutting edge of these things. You have to stay current with them. It doesn't mean you have to have every new thing that comes down the line, because you also have to be able to differentiate. You have to know what it is about the injuries that you treat that you're looking for. All modalities and all things that can be applied don't necessarily apply to how you're treating those patients, but primary has to be your purpose of getting great patient results. That's what everybody in the market needs. That if you stay on course with that, what it does is it helps you to avoid schemes. It helps you to avoid things that are about making money instead of talking about patient results. I listen in the market a lot, and I listen to a lot of leaders and a lot of speakers, and they basically are they're appealing to the greed of the doctor in my experience. And because they're not talking about better patient results. They're not talking about, look, a doctor's job in the injury market is to reduce patient benefit needs, long-term benefit needs. Now, let me make that quite clear. That's called results. So if a patient comes into your clinic or my clinic, if I had a clinic currently, if they come in and let's say they're in a back injury and they went out to an emergency room and they went through the emergency room, nothing could be found. They did all kinds of testing. Nothing could be found. And when I say the testing, maybe they had a CT scan, maybe they had an X-ray, And since, nobody's looking at excessive motion for ligament injuries, nobody, all that gets missed. But the things that medically get picked up, they don't have serious fracture. They don't have a cord injury. That's all been ruled out. But they're in a wheelchair, right? Because they can't walk. They can't figure out, nobody can figure out why, right? Now you get them in and you diagnose and treat, and 6 months later, they can run a 5K run. The benefit need reduction is very apparent. You've reduced the long-term benefit need of that patient. If that patient stayed in a wheelchair, their long-term needs are much higher. So their benefits, you remember, as a doctor, your job is to document in a way that allows the patient access to any benefits that they may be entitled to. But what your job is to do is to reduce benefit need, not increase it. That's called patient results. Now, when that happens, the insurance carrier is happy. The patient is happy. The patient's attorney is happy. Everyone in the market is happy. That's what they're all looking for. Now, some doctors, I've coached enough doctors. Some doctors think that, attorneys want, everything to be a large settlement. And that's been not my experience. My experience is that most attorneys want to quickly resolve a claim. They want to get the claim resolved as quickly as possible. And so when you're able to do those things, that makes all the difference in the market. But you'll see everything basically is on results. Everything still, no matter if I want to get attorney referrals. So I train doctors on how to get attorney referrals. And one of the things I teach doctors to say in presentations, and I want them to own this. I really want them to own this. So if I'm out doing a presentation in my clinic, when I had a clinic and we were getting great results and we were very good at injury work, I would tell the attorney, look, we're a clinic that if you or someone you cared about or loved was in an injury and let's say they had migraine headaches, your son or daughter had migraine headaches and now they're throwing up. They get the aura, they get dizzy, and then they throw up. And they're doing this 2 or 3 times a week, because they got an upper cervical ligament injury that's causing the migraine headaches. Well, you better have, I am the clinic. We're the clinic that'll find and figure out what's causing the problem, and then we're really good at treating the condition. So if you or your son, your daughter, your family member, when they're in an injury, the first thing you're not thinking about is, well, gosh, how much money are we going to make? That's not what you're thinking about. You're thinking about, oh my God, I have a loved one that's in serious trouble, and I need to find the best. That was us. Now, that's what I train doctors to be also, and you lead with that, right? You don't want referrals because you're good at running patients through a mill. You want referrals because you're good at getting incredible results with patients. That's what you want to be running. That's purpose, and that's a purpose-oriented practice. Now, for me, it was really easy to get the purpose and to get to that purpose because 50% of the patients that have a soft tissue injury, a ligament injury, are not going to fully recover according to statistics. And 30% of those are going to have some serious problems. Now, that is not a patient problem. That's a doctor problem. And so, I've said many, many times, an injured patient should never go to somebody in the middle of the bell curve. They should always be striving to find a doctor that's at the head of the bell curve, the front of the bell curve, top 20%, top 10%, top 2% if you can find them, right? Reminds me of a story when I was in private practice. I had a patient that I treated on and off for years as a chiropractor in a chiropractic practice, and she had an injury. And she had come into me, it was like 3 months after the injury. And she was in an auto accident, and she had badly, it was a side impact, I believe, and she had badly fractured her leg and hip. And in the accident, it was that bad, and she was waiting for that to heal up before she came in and started to see me. And I asked her, who she was doing rehab with for the hip. And she was doing it with a physical therapy center that was very close to her home. It was very convenient, but it was a geriatric Medicare PT center. They didn't have any experience with those kind of fractures. So we located a an area. We located a PT program, clinic that she could go to that handled those types of injuries, because I made it clear that even though she'd have to drive farther, that her rehab was something that was going to, affect the rest of her life. And so you needed to find the best of the best. And that's what you want to strive to be. That's your North Pole. That's what tells you, hey, if I'm going to do marketing, good. Is this marketing? Remember, marketing is how you're perceiving the market. Does this market improve that perception of me in this market? Yes. Great. Let's go for it. Education. You want to continuously strive for education. There's a lot of different education programs on personal injury and on, you can spend weekends. You can go online. You can go on courses such as the one that I have. You can go on courses with other injury providers. And I'm going to tell you, you're going to gain something from every single one of them. Every single one of them. Right? So, but your North Pole has got to be, can they help me get better results? Can they help me get faster results? Can they help me get more economical results? Is that their purpose? In the Smart Injury Doctors program, that's our purpose. Right? Now, the part is, our purpose is to educate you, actually, to be able to do that, to be able to think with and to be able to maintain that North Pole. That idea of, this is the direction I'm going. So purpose in a personal injury practice is huge. You got to have the right purpose. I've met doctors where I immediately went, they don't have the right purpose. This is in there about the money, and the money will go. I mean, money will come and it'll stay and it'll get very, very large for those that are doing things for the right reasons. It really will. That's been my total experience. So doctors, what I want, each and every one of these podcasts, I just take a short topic and talk about it. It gives you an idea of my position, of how I teach, how I train in the Smart Injury Doctors program. And so I'm very, very happy that you attended, that you listened to this. What I'd ask is leave comments down below. Leave comments down below. I read them, and it helps me to understand what might be a good topic to bring up. Leave me what your two biggest struggles are. What are you struggling with in personal injury? Because personal injury is the most purpose-driven. To me, it's the most fun. Yeah, there's negative things about it. There's negative things about everything. But it is the most purpose-driven portion of my practice. It was, and I think of anybody's practice, it really can be. So leave your comments down below, and I'm happy that you tuned in. Tune in to all of our podcasts, and as always, have a fantastic day. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.